Since 2018, 8.4% of female servicewomen and 1.5% of male service members experience unwanted sexual contact. The Marine Corps saw the highest percentage of women experiencing unwanted sexual contact with 13.4%. The Navy was the second highest following that. We are trying to provide awareness of sexual assault that occurs in military settings between fellow military personnel. There are many factors that go into these instances being not reported. Many people who experience sexual assault in the military do not report it due to social stigmas, fear of social repercussions, maybe fears of losing their career over this, and their own personal implications. We are making this video to demystify the reporting process of a sexual assault in the military. Our hope with this is to increase reporting rates and comfort level of people wanting to report.
Hey, Doc.
Hey, what's going on?
I have a patient today, female, age 27, heart rate 110, respiratory rate 22, blood pressure 118/76. She reported pain 6, as temperature is 98.3, O2 stat 98. I did notice that she is experiencing diaphoresis, and she also noticeable things are that she won't look at you straight directly into the eye, and she does seem a little bit restless, like tapping, and I think that seems to be it. She is waiting for you.
So she's got some elevated vitals and
Yes.
appears nervous,
Yes.
and she won't make eye contact with you at all?
Yes.
Okay.
So
Okay.
that's good.
Thank you.
Yep. No problem.
Hey, Lieutenant Kerner.
Yeah.
How you
Yes,
doing
sir.
today?
I'm good.
You coming in on your day off today?
Yeah.
Okay.
I got a day off finally.
How's your day going today?
It's fine. I mean, I'm just here, so
Yeah.
it's fine.
So, what brings you in today?
I'm having like some stomach pain.
Okay, some stomach pain?
Yeah.
We can take a look at that. I'd like to ask you a couple questions about your pain. Do you know around about when it started?
I think like yesterday.
Okay. And does anything make it better or worse?
Pretty much everything seems to make it worse.
Okay, so it's kind of like a constant pain.
Yeah.
Does it spread to any other parts of your body, or does it stay?
No,
localized
it's just
there?
my stomach. It's only my stomach.
Okay. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, where about would you put that?
It's like a 6, but like these, I think I should just go because like this is making me kind of uncomfortable. So I think I'm just gonna go.
Before you go, we can definitely kind of change topics, and I can ask you some questions to help fill in some blanks on my chart. We don't have to talk about your pain right away. Is that okay?
Yeah, I guess I can answer some questions.
Okay. What about your sleep? How would you describe your sleep in the last couple weeks?
Like this is just to fill in my chart, right?
Yeah, we're just filling in some blanks in your chart here.
I mean, like I sleep enough. I mean, it's kind of hard to sleep, but I sleep enough.
Okay. Do you have any nightmares?
I mean, yeah, but everybody has nightmares. Like everybody has nightmares that wakes them up.
Okay. Do you have enough energy, would you say, to do the normal things that you do during the day?
I mean, I guess I just go to work and then I go home, and that's it. Like that's all I have to do.
And it says here there is a bit of a history of anxiety. You might have filled something out. Can you tell me a little bit about that? Do you have a history of anxiety?
I mean, like I get anxious sometimes. I mean, this is like I've been feeling anxious lately, but I just
So would you say it's more recent, your anxiety?
yeah.
Yeah.
Like
Okay.
I mean, the last like month.
And would you say it's, how would you describe it? Like racing thoughts or?
Yeah, like I just have repetitive thoughts and like I just get really anxious and like I don't know, it's like hard to describe, but like my heart races and I just get kind of sweaty and yeah, I just don't want to be like in that situation anymore.
Okay. Are there any situations that make you feel more uncomfortable? Like, are you talking about being in public or?
Yeah, I mean, I just go to work and then I don't want to be there, so I go home and like I just get through it, but
Okay.
I like to be at home.
So let's talk about work for a minute. Your relationships at work, friends, coworkers, superiors, subordinates, how's that going? Anything stand out that you want to talk about, or you feel supported at work?
I mean, I'm up for promotion, so I just don't want to. I don't want to do anything or say anything that puts that at risk because I've worked really hard to get there.
Yeah, absolutely. That's awesome that you're up for a promotion. Why would you feel like, do you feel like coming here is putting you at risk for a promotion for some reason?
I mean, I definitely could. I don't think that this is. I don't think this is a great idea anymore.
Well, so I can see that you're feeling uncomfortable talking about work and with me. I just want you to know that this is a place of 100% confidentiality, and anything that you tell me here will not go back to anybody else in your unit, your supervisors, people you might have below you, anything like that. So anything you tell me stays between us.
I mean, I feel like you just have to say that as a doctor. Like it doesn't really mean anything. Like I don't know. He could find out.
So I noticed you said he. Is there anyone or anything that you'd like to talk about in regards to people at your unit?
Or I mean, I don't think it's like, I don't know. I just feel like I can't talk about it because my promotion that'll put it in jeopardy and I worked so hard to get there. And I really just need this abdominal pain, like, dealt with.
Mm-hmm. Okay, we're definitely gonna continue looking at the abdominal pain. But I really want you to know that anything that might have happened to you is totally confidential in what you tell me. We don't have to disclose anything to anybody, and what you tell me doesn't leave the office.
I mean, is it really necessary for you to know to like fix my stomach pain?
The reason I'm asking you these series of questions is to get a better understanding of what caused your stomach pain, and that is going to drive our treatment. And I just want to make sure that you get the best care that we can offer you.
Alright, like, it wasn't that big a deal. It's just like, he told me to meet up with him and then he could help me like with my promotion and like getting that through. And then like, it just like turned into something more than, I didn't really want to do it, but I was afraid if I didn't do it, then my promotion, like I've just been working so hard.
Mm-hmm. Okay. Do you feel like you were manipulated to do some things that maybe you weren't really wanting to do?
I mean, that's a big word, but I mean, I didn't want to do it, but it doesn't, I don't know, like I did tell him that I wanted to stop, but then he said that, like my promotion just wouldn't go through.
Okay. So everything that you're telling me right now will not go back to this person unless you want to start some kind of investigation or anything like that. Okay, just right off the bat. What you're describing is sexual assault. So, and that is any kind of unwanted sexual contact, anything. And what you're telling me, that 100% fits the bill. And I know you said that you were nervous and scared of anybody finding out at your unit. But because you're in the military, there's actually two different types of reporting that you can choose, direction you can go that will help protect you.
What do you mean, like, 2 types of reporting?
So there's what's called restricted reporting and unrestricted reporting, right? So restricted reporting, that's confidential reporting to designated military personnel, and it does not trigger any kind of an official investigation. Okay? And then,
Oh, like, nobody would find out at all?
correct.
Oh, okay.
And then unrestricted reporting, that is the direction you would go if you wanted to start a kind of criminal investigation.
So, like, everybody would find out?
Well, we would notify the police, and then it depends on what direction they go. They'd have to conduct like interviews and things like that.
So, like, what would happen right now?
If you chose unrestricted reporting, or
Yeah, like, if I wanted to do something about this, what would happen right now?
well, the first thing that we want to do is take care of you, right? So before you choose restricted or unrestricted, we actually have a nurse that specializes in this type of thing, in sexual assault, and we have some scans done to make sure that there's no physical damage, and that nurse would guide you through STD screenings, pregnancy testing, and physical evidence gathering process. And if you're okay with that, I can go get them. They're here right now, and they can join us in this conversation.
I mean, I guess if they're, like, specially trained, I don't know what that means, but yeah, I guess, like, I mean, I guess they can come in and talk. I still don't really know what to do about this, but I guess just talking to them wouldn't hurt.
The nurse can help you through this whole process, and you don't have to make a decision on whether you want to do restricted or unrestricted reporting right now. Okay, so
Okay,
just
yeah.
stay here, and I'll go get the nurse and bring her in here.